In this video, I'm going to show you how to quickly self-assess your own neck mobility, especially if you have chronic neck issues or a lot of tension there. We'll figure out if your neck mobility is a weakest link that you should be training. Before we're doing any of these movements, I want you to be aware if you have any pain or major discomfort with any of them, just know that's an automatic fail for that test and know that this is automatically a weakest link that you should be working on. All right, before I show you some of the movements with Sheridan here, the first thing I want you to do is self-record yourself doing these movements so you can really break down where you have those biggest limitations. So the first movement we're gonna do is neck or cervical flexion. So Sheridan, what you're gonna have you do is just look down or try to bring your chin towards your chest. And for her, if you could touch your chin to your chest, automatic pass, you're having a good time. For her, she's slightly off, but she definitely meets that 60 degrees requirement. So good job, Sheridan, you passed the first one. The second one, we're gonna be doing cervical extension, and that's just kind of looking up towards the ceiling. So when you're ready, look straight up, and for this range, we're looking for at least 75 degrees. Now, most people, we would like them to be as close to parallel to the ground as possible. She's right about 80, maybe even 85 degrees. Automatic pass. This is usually the first movement we lose when we have a neck mobility issue, so make sure to film yourself doing this one. Next, we're gonna be looking at cervical or neck rotation. So just as it sounds, we're gonna look to one side. So Sheridan, when you're ready, nice. And for this one, we're looking for about 80 degrees. So I'll show it from the side here in a second, but Sheridan's almost at 90 degrees here. We got a pass on the right side. When you're ready, let's go to this left side. A little bit more restricted, but definitely meets that 80 degrees, which is what we're looking for. Another pass there, but let's show this one from the side. So let's test that rotation from the side now so you can see a better look. So she's gonna rotate, and that chin is right around where that clavicle or that collarbone is. That's a pass. And if you can't rotate and meet that, then you know cervical rotation is a limiting factor for you that you need to start training. And our last movement for the cervical spine or the neck is lateral flexion. So that's just side bending from side to side. So Sheridan, when you're ready, she's gonna go to that right side. And what we're looking for is a 45-degree angle. So I can tell she just about hits it here on her right side. And then let's go to the left. Even further on this side, so she passes both these. Actually, you pass all these movements. So good job, Sheridan. Your neck is not your weakest link. If a lot of you struggled with these movements or even felt some pain or pinchiness, then you know neck mobility is one of your weakest links, and the neck mobility programs are something you should prioritize within the membership.